SolRx Incorporation and its review programs are neither related or endorsed by Pharmacy Examination Board of Canada, which is also known as a PEBC. SolRx Incorporation does not provide any certifications. PEBC is a trademark of Pharmacy Examining Board of Canada and is not related to SolRx Incorporation.
So this is basically an OSCE course orientation in case you are interested in taking SolRx prep course for OSCEs. We are going to go through a little bit about PBC expectations today, what our course has to offer, and we will do a sample case for everyone so you understand what a OSCE case should look like. So on the screen in front of you, what you should be able to see now is the agenda for the day. Like I mentioned, you're going to get introduction to the team, an overview of the OSCE exam, an overview of the course, some common mistakes to avoid, some tips for success, sample performances. We're going to share some success stories from our previous students. And then of course, we'll close off the session with a Q&A. If anyone has any questions that you would like answered, we will try to answer them promptly. Throughout this session, if you have a question that you do want to ask, please feel free to utilize the chat function on Zoom. You'll be able to ask a question there, and one of our faculty members will try their best to answer it for you as we continue along the presentation. So first off, I do want to introduce the team to you because some of you may know who SolRx is, some of you may not. So for that reason, this is pretty much the core team of SolRx. However, these are the people that are here today. The team is quite large, and you'll eventually meet more faces throughout the course should you decide to take the SolRx course. First off, we have Vipul. He's our founder for SolRx. He's right here beside me, and he will give a short, brief introduction about his story and what SolRx is.
Good evening, everyone. My name is Vipul. As Parmit mentioned, I started this in 2010 after graduation in Canada. And you'll wonder that at what age I graduated. It's a mystery. So many people are asking that, I did my pharmacy 5 years back and 10 years back, and I don't remember anything. It's too difficult. The system here is different. I'm just sharing my story so that you will feel better. I started studying after 30 years of gap, my basic graduation, and when I started studying here. And I got my license when I was 50 years old. When I was doing preparation of this OSCE, there was no one to teach. So I thought, international pharmacists are lost and they don't know because the system here is totally different. We all are very qualified, but when the system is different, when things are different, we are lost. So we started this to help, and we started with a small scale, but now we are doing a lot of things on top of OSCE, which we are going to tell you later on at what more products we are telling. But today we are going to more focus on OSCE. Now, we have a different faculties, and different faculties has a different role here, and all are qualified to teach. We must know that we need to develop the course material regularly. So our philosophy for SolRx is first is student care. You must be knowing the competency of PBC. What is the biggest competency you must be knowing? It's 42% to 50% is patient care. Our competency, if you put it as a competency, is student care. Another thing is we care for students and we respect them, because if they ask questions and you might be thinking it's the most silly question or stupid question. No questions are stupid. No question are sorry. So feel free to ask us because we have gone through the same thing what you are going through now. So we can relate and we will to answer. That's the first thing we are going to do. We respect your knowledge. And who is our biggest teacher? Students are the biggest teacher for us because they ask question, we learn it, and we produce, right? So that's the second philosophy: student care, respect student. Third is continued education. So we are getting all our materials updated. There are few things where we update ourselves. First is your questions, which is going to help us. And the second is we do update every time whenever something new comes up. so that we are not behind. We are always ahead of PBC. So whatever we anticipate, we know the trend. We can extrapolate and find out that this is what is coming. So we put in our course. So this is what OSCE is about. This is our philosophy. Guys, many more introduction is coming, but this is in a brief what we are and what is my role here. Thank you very much, guys. Have a great day. And we'll be continuing with Parmeet now.
Thank you, Vipul. So a very quick introduction who I am. I'm one of the directors here at SolRx. So my name is Parmeet. And I've been part of SolRx for many, many years. I graduated as a pharmacist from the University of Toronto, so I'm a local graduate. I spent a few years managing a Shoppers Drug Mart, so I was a pharmacy manager there. And then I also did a few years with Sick Kids Hospital. I did some pediatric oncology research, and I'd spent some time there, and I still do consult for Shoppers Drug Mart associates here and there about any pharmacy incidents that do occur in the pharmacy. So I work pretty closely with head office, the PharmaPod reporting team, as well as many associates. If there's any concern that pops up in our dispensing area that happens, I'm usually the person they would reach out to kind of make a report for OCP as well as any investigating officer. Besides that, with SolRx, I'm one of the main instructors for OSCEs, MCQ, and we are leading many other products such as the Red Cross course, which is for first aid and CPR launching in July. So there's a lot of products that are under SolRx's belt, but as Vipul mentioned, today we're going to focus on OSCEs. Very quickly, I'm going to introduce the faculty members that aren't here today. Quickly is going to be Arav Shah. He's also one of the directors here at SolRx. And you will also get a chance to meet him throughout your classes should you decide to enroll with SolRx. He's also an owner of many pharmacies in the past. So he has a lot of experience when it comes to managing and owning independent pharmacies. We also have Ala, who is one of our OSCE and OSPE instructors, as well as MCQ. And then we have Tumama as well, who you will notice will be one of your main instructors for the WhatsApp group. I'm going to hand this over now to Young, and she's going to do a quick introduction for herself, and then we'll slowly introduce the rest of the team and get the show started.
Hi everyone, my name is Haeyang. I'm an international pharmacy graduate and I was a SolRx student. I came to Canada not knowing anything about the system. So what you're going through resonate with me as I went through the same experience. After taking SolRx, luckily I passed OSCE with the first attempt. And ever since then, I've been working with SolRx, developing content materials and teaching for both MCQ and OSCE. And I'm currently community pharmacist in Ontario, and I was working as a pharmacy manager in one of the big retailers. And I'm mainly going to be one of the main instructors for OSCE if you join SolRx. And I'm very passionate about helping you guys as I understand how sometimes difficult or challenging this journey could be. So we're happy to help you throughout any part of the journey. Now I'll hand the mic to Mohanad.
Hey everyone, good afternoon. My name is Mohanad, but as a shortcut, I make it as Mo because of the confusion between Mohammed and Mohanad. So you just can call me Mo. I moved to Canada in 2018. I used to work as a hospital pharmacy manager before I moved here to Canada. Now I have a bad news and I have a good news when it comes to OSCE. All right, the bad news that you need a consistent practice and continuous practice, and you will be under a lot of pressure until you make it. Okay. The good news is, if anyone asking, should I work in a pharmacy as a pharmacy assistant or intern or student so I can pass this OSCE, I will tell you not. Okay. I passed this OSCE exam without stepping a foot in a pharmacy once I came to Canada. I occupied all kind of job in Toyota, in TikTok, in chemistry lab even. All right. And I stepped the first time that I stepped myself or my foot in a pharmacy was when I became a pharmacist. I am working with people since I was even a student still, and until now, and I'm working in a community pharmacy also as well. I helped also in writing the materials with the young and people. Also, you'll find me conducting some classes, and I will be your instructor, and we will be always taking your hand, walking you step by step if you decided to join us to pass this OSCE. I'll see you there. Ella, the mic is yours.
Thank you, Mohammed. I think Mo. The reason why you don't have to go to the pharmacy, it's not compulsory, but it helps. The
Yeah.
reason why our course is designed in such a way that we are explaining each and every step. And we knew that there are so many students who never step in, never had a chance. So that's why our course is designed in such a way. Very much detail. We start from the drop-up section to pick-up session. Nobody will be knowing what is drop-up. When I came here, I didn't know. So we are going through each and every step. That's why we don't. Of course, working in a pharmacy is a bonus, but it's not mandatory, guys. Okay.
Thank you, Ella.
All right, thank you so much. Hey everyone, my name is Ella. I'm a pharmacist in Ontario. I joined SolRx in 2022. I understand and I get it how overwhelming it can be to prepare for PEBC exams. We hope that we make this journey easy on you, especially that I understand that most of the students here or the candidates who join this meeting have families or maybe have jobs, and they try to balance between both of them. So we hope that we make it easy. We help you. I will be one of the main instructors for OSCE, and looking forward to assisting you all.
Thank you, Ella. So this is our wonderful team here. You'll probably see a bit more faces throughout the course should you decide to enroll, but these are the faculty members you will interact with regularly when you are part of the SolRx OSCE course. So now let's talk about the OSCE exam in general, because we all might be wondering, what is OSCE? Some of us may have written the exam before, so we have a little bit of experience, but some people may be writing the exam for the first time. So it is very important to understand what are the expectations of the exam. So the OSCE exam, the main purpose of this exam is to assess communication, assess your problem solving skills, whether you're able to make clinical judgments in a professional manner. OSCE means objective structured clinical exam. At the end of the day, there is going to be one expected answer. But the way you get to the answer must be in a structured format. You must follow a certain flow. And then, of course, it is a clinical exam. The exam consists of 11 stations. Historically, there used to be a few more stations. Those are called pre-test stations. But ever since COVID, PBC has always kept it to 11 stations. And all of the 11 stations are considered to be marked. So they will be considered when they're deciding whether you pass or fail the exam. When it comes to these stations, there is a separation of non-interactive and interactive stations. What do I mean by that? An interactive station, like the word implies, means that you will be entering a room, you will be speaking to a patient, it could be a doctor, it could be a caregiver or an agent, and you are going to try to figure out and solve the problem of the case. At a non-interactive station, it is going to be, for example, a Q&A, question and answer case. They might ask you 5 different questions and they will give you a reference. You have to answer the questions. It might be something like product dispense checking. If you work in a pharmacy, you know what dispense checking is. But for those of you that do not know, dispense checking is essentially looking at a prescription and comparing it with the product that is being dispensed by the pharmacy to ensure it is accurately filled and it is accurately dispensed. Or you can get something called prescription screening, where you get a bunch of prescriptions written by a doctor and you have to identify if there's any issues with it. If there are, you have to identify what those issues are. There's a variety of non-interactive stations and there's a variety of interactive stations. You will get 9 interactive and 2 non-interactive. All are going to be 7-minute stations. So 7 minutes, you might feel like it's not enough time, but honestly speaking, a lot of stations are created in a way that they should be solved within 6 to 7 minutes for sure. Sometimes you might have a little bit of time to double check your work if there's anything else you want to add. And between stations, you usually have 2 minutes. That means you get time, you get a chance to potentially read the door note between the stations. So if you look at it in this kind of diagram, exactly pulled from PBC's website, you're going to have 2 minutes between stations or at the beginning of a station before it begins to read the door note. During this time, you want to be able to break down the door note, understand what it says, and write down any pertinent information to the case. Sometimes the door notes provide a lot of information, sometimes they don't provide much information. But throughout this course, you will understand how to dissect the door note so you're ready for what's to come inside the room. An example could be a patient is waiting inside the room for an over-the-counter recommendation. Now, when you see the word over-the-counter, you start thinking CTMA. It could be something regarding over-the-counter products. So there is a special algorithm or a acronym that we follow when it comes to approaching these cases. Or it might say Dr. Brown is waiting for you inside the room. So now you know it is a healthcare professional case. So these are the small tips that you want to keep in mind when you're reading a door note. Essentially, after the 2 minutes are up, you're going to hear the first bell. That first bell indicates that your station has started. You open the door, you enter the room. During this time, you might sometimes see that there is no actor inside the room. There's only an assessor there. The assessor is there just to mark you on your performance and how well you do. They're not going to be there to talk to you. The only person you'll be talking to in these stations is the actor. However, in some stations, the actor enters after 20 seconds. So what you do during these 20 seconds is very important. You must be able to understand what's on the table, look at your references, scan a profile. All these skills are developed within the course. After 20 seconds, the actor enters and your station pretty much has begun. At the 5th minute mark, you will hear a warning bell telling you that there are 2 minutes left in the station. At this point, sometimes there may or may not be a 5th minute question, but how you address that question is very important. Sometimes students get freaked out and they don't know what to do, and unfortunately that could be the reason of failing the case. And then at the 7-minute bell, you will hear the final bell, and your station has now ended. You get up and you go to the next station. You rinse and repeat this pattern for a total of 11 stations. This is just to give you a brief overview of what the exam is going to look like. Of course, within our prep course, we will go through a lot more detail on what you should do pretty much every minute of the case, up until the final bell. And what are some tips and tricks to ensure that you pass the case, even if you're not quite sure on how to approach and solve the outcome. So like I mentioned before, there's different types of stations. Within the stations, you're going to notice different types of scenarios and cases. For example, with interactive stations, you might get counseling, therapy recommendations, clarifications, identifying issues with doctor prescriptions. With non-interactive stations, you might have to identify drug therapy problems, finding information from references. References is a big skill that many people underestimate. Going through a reference within a 7-minute time frame is important. What if I give you a 15-page reference? How are you going to go through the reference and be able to answer the questions the actor is asking without running out of time? Again, these skills are developed through a lot of practice and through the tips that we share with you. There will be a bell system at the end of the day that the PVC will share with you so you have an understanding of what to expect. So for now, we're going to hand this over to Hyung, and she's going to talk about some common mistakes to avoid, as well as some tips for the exam. Hyung?
Thanks, Permit. So some common mistakes that we've noticed the students make first is memorizing cases instead of learning structure. OSCE cases are designed in a way that you need to have very good interview skills. Your answer that you get for one of the single question can completely change the outcome of the case. So if you memorize the full case and jump the gun and land on the conclusion without having good flow or communication technique or clinical reasoning, it's highly likely that you will not the case right. So we learn throughout the course of what to have as a communication technique, what questions to ask, how to implement it, but this is something important to keep in mind. Second mistake that a lot of students make is ignoring time management. At the end, as Permin mentioned, the cases are designed for you to finish the case in 6 to 7 minutes. Some students don't practice time management and run out of time. Some students end up asking irrelevant questions and wasting time. So it's very important to keep in mind when you're practicing how to successfully finish everything within the given time. Third mistake that we've noticed is skipping non-interactive practice. So as we briefly talked about earlier, there are 11 stations, 9 being interactive and 2 being non-interactive. Non-interactive station should be your station that you get full mark or fully pass from that in case you sleep or get nervous in an interactive station, non-interactive should always be there to support your full mark. So make sure that you allocate a certain amount of time every day so that you don't let this go. Now, fourth mistake would be weak acronym usage. So SolRx has developed various acronyms that you can implement for different type of interactive stations. It's summary of questions, as I briefly mentioned, the interview skill. There are certain questions that you want to ask in certain scenarios, and it's more of a summary or an abbreviation of those questions. So it can easily click in your head that, okay, I need to go through those questions because the patient is coming to me with this concern. And it's always a good idea to have that acronym. We don't want you to be fixed on it. And we'll talk about this and practice this in class, but you should have a structure to use when you walk in. And this will help with staying with the flow. This will help with having good communication skills, good interview skills, getting good answers, and not wasting your time. So that's going to be one mistake to avoid. Another one is underestimating role play practice. OSCE is very different than MCQ. MCQ, you study by yourself with your course material, you memorize, you solve your multiple choice questions to practice, and you don't necessarily need to have a study group if you can keep track of your study progress. However, that's not the same case with OSCE. OSCE, you must role play, you must practice with your peers throughout the prep time to be successful in the exam. It's an exam that you have to demonstrate your skills. And having a knowledge in your head or knowing what to do is not the same as actually doing it and proving and performing in front of your assessor. So practicing out loud and stimulating that live station, with your peers as much as possible will be a key takeaway that you need to keep in mind. Last mistake that I want to share with you guys is delaying studying and practicing. It's not an exam that you can just get ready overnight or within a week or so. As that goes with the role play practice, it's a build up and practice throughout multiple weeks, throughout a few months, throughout a semester to build your skills and successfully demonstrate it in different scenarios. So it's not an exam that you can cram. Now, with this in mind, what are some pro tips for success? So some tips that to kind of reiterate with the mistakes and to learn from it is first to focus on the structure but not script. So we don't want to memorize cases. PBC is known to bring cases that you might have heard somewhere, you might have seen somewhere. However, the answer changes all the time because they change the script over time. So it's important to understand how to approach each case type, which we will provide throughout the course. Using your different acronyms and communication flow, you will need to adapt using your professional judgment. Practice with the timer to make sure that we can finish each station within 7 minutes. Role play regularly, practice with your peers often, and master acronyms early by following along the course and make the acronyms yours. Now, important point is to use feedback to improve. When you're role playing, which in our course we do for each student to practice or role play within the class, 1 or 2. In the very beginning, we do 1 role play per person to build the in-depth feedback, but later two practice per person. And also every time you practice with your peer, you'll need to get feedback. In our course, we give verbal and written feedback, which Parmeet will discuss later with an example. And we as mentors or instructors give detailed feedback. But even when you're practicing with your peers, it's important to have you, performer, and an actor that you practice with, your practice peer, and an assessor, which will be another peer that you practice together, so that you can share your constructive feedback to others and learn from it. Make those feedback yours and develop your skills. Now, lastly, stay consistent. As we talked about, it's not something that you can do overnight. So build a regular study routine, and short daily sessions are more effective than cramming. Now, I'll hand the floor back to Parmeet.
No.
Some few more points that we told, or Han mentioned about what are the things we need to do it and how that tips and the success, right? So now what SolRx does, whether you're online or on site, we'll discuss very much in detail that how we mimic PBC stations, PBC style. Even from day one, what we are doing is it is exactly like what you are going to do in PBC exam. In the exam, you won't feel anything. You will feel that you're in a SolRx class. And very important thing is, in a class size is so less, 10 or 11, we know your progress very well as our class approaches to 1 to 2 and 2 to 3. We have a tool to monitor whether you are studying properly or not. I think in the later part, we are going to show you also that what we do, so that we are not just telling you the problem, we are giving you a solution for each and every things what is necessary for OSCE. You will be monitored throughout the class, and in case you need any extra help, we'll be helping you throughout. For example, English is an issue. So we'll give you a case according to what you need. So you know your strength and weakness, and we are going to more focus on our weakness as we progress. So there could be a harsh assessment, and it could be a lenient assessment, depends upon what you need. So we make sure that your moral is not hampered also, and you are not overconfident also. So we'll balance it out. So we are not telling the problem only, we are always telling that how to solve it. Okay, so this is what I'm concluding with the tips of the success and what we are doing to solve these cases.
Thank you. So before we get into what the course has actually to offer, because there's a lot of sources and resources that we give throughout this course, which Vipul and Hayang both mentioned already. And these resources are feedback reports, are sample cases, as well as one-to-one interactions during class. But before we get there, we want to show you what an expected OSCE case should look like. Because you might be wondering, if an OSCE case is 7 minutes, there has to be a structure. What is the structure supposed to be? So of course, there is a guide, there is a structure that we have developed at SolRx. You learn more about those structures and guides throughout the course. But for now, we are going to do 2 sample performances, so you have a bit of understanding of what's expected, and then we will do a little talk about the details of the course. What are the books you're getting? When do you get them? I see some questions about a February exam. We will discuss everything for you. I also see some questions about English, or some questions that were popped up about where to start preparing and how to start. Those will all be addressed in a moment. For now, we're going to look at this door note. This is an example of a door note that I talked about earlier. In the exam, you will get 2 minutes to break down and dissect this door note. So let's read it together.
Station started. Station started.
So
role play.
So here, a patient is coming to purchase his regular supply. You have seen him buying the same supplies every couple of weeks. He buys only over the counter from you and gets prescription medications from other pharmacies. And then it says, assess the situation as you would in practice. The references provided here are the product monograph and syringes on the table. So now we have 2 minutes to dissect this. So first off, we see that a patient is coming to pick up their regular supply. But at the bottom and under the references, it talks about syringes. So most probably this case is related to some sort of syringes. He's coming to buy it every couple of weeks. So we must identify, why is this person buying syringes? And he only buys over the counter from you and gets other medications from other pharmacies. So that means he probably goes to other pharmacies as well. but we're not quite sure. This is just assumptions based on the door note. So now we're going to start this case. We're going to put a timer on so we know that we can do this within 7 minutes. Some cases may be finished in 6 minutes. Some cases may be finished in 7 minutes. Some cases, information gathering may only take 2 minutes, but in some cases it can take 5 minutes. The idea is you must be able to adapt your performance to the case that's in front of you. So for this, I will be the pharmacist, and Mo, you are going to be the actor for this case, and we're going to go ahead and get started, okay? To simulate what you would see in everyday practice as in the exam, if you're taking our online classes, this is what it's going to look like. Since Mo is the actor, he's going to turn off his camera for about 20 seconds. After 20 seconds, he's going to turn it on. That is simulating an actor entering the room. So we're going to go ahead and get started. So station has started, 20 seconds is now on the clock. So now when I enter the room, I'm going to see what's on the table. All I see right now is a syringe, and there is another reference on the table for testosterone. During this time, I have to get myself ready and organized and be prepared for when the actor enters the room.
Hello.
Hello, my name is Parmeet and I'm the pharmacist here today. How can I help you?
Hi, can I have a 3 ml syringe? I'm in a hurry, please. Can you make it quick?
I can see that you're in a rush. Absolutely, I can help you out. However, being a healthcare provider, I do have to ask you a couple of questions if that's okay.
Sure, all right.
All right, please have a seat. Just know that this is a private counseling area. Whatever we discuss will remain private. First off, how may I address you?
My name is Mike Stone, but you can call me Mike.
Okay, Mike, and can I get your age, please?
Yeah, I'm 30 years old.
All right, Mike, I see that there's no profile here at our pharmacy. Is it okay if I go ahead and create a profile for you?
Sure, that will be wonderful.
So you said you wanted 3 ml syringes. Can I inquire why you need them?
Yeah, I use it to inject my medication.
I see. And may I know the name of the medication that you're injecting?
It's called testosterone.
Okay, and do you have any medical conditions for which you use the testosterone for?
Honestly, no, but I use it to build muscles. It's work wonderful.
I see. Have you seen a doctor for this? Because this hormone can help build muscles, but it's usually not for everyone.
Well, no. Do I have to, though? I just want the big muscles, my friend. All my friends used it, and man, it looks really good.
No, I understand that it does help build muscles. However, it's not healthy for you in the long run if it's not being used for a certain condition. For that reason, you usually do need a prescription medication for this, and a doctor does have to assess you to ensure it's best for you. Do you have a prescription for this?
No, unfortunately.
Okay, Mike. And how often do you inject the testosterone and how much?
Well, I take 1.25 ml once a week.
Okay, and how long have you been using it now?
I've been using it for around 3 months, and I inject it in my muscles by myself.
Okay, have you noticed any symptoms, any negative impacts?
Not so far.
Okay, earlier you mentioned your friends are using it. Do you share needles with your friends by any chance?
Well, I know that some of my friends do, and I get tempted sometimes to share needles, especially when I run low of syringes. But
Okay,
I never share syringes, honestly.
no, that's good to not share syringes. I will discuss more that on that later on. And how do you dispose of your syringes?
And the trash bin.
Okay, thank you for your honesty, Mike. I would like to ask you a couple of questions regarding your general health to finish completing your profile at the pharmacy. Is that okay?
Sure, go ahead.
Do you have any allergies?
No.
Do you have any medical conditions?
Nope.
Do you take any prescription medications?
No.
Okay, and do you happen to take anything over the counter, such as Tylenol or Advil?
None.
Any vitamins, supplements, or herbals?
No.
And do you happen to take any samples from the doctor?
No.
Okay, thank you, Mike. I also have a few questions about your lifestyle, if that's okay.
Sure.
Do you happen to drink any caffeinated beverages?
1 cup of coffee a day.
Okay, I will note that down. And what about alcohol?
A glass of wine on the weekend.
And do you happen to smoke?
No.
And what about any recreational drugs?
No.
And do you exercise?
Yeah, but not that much.
Okay, and how can you describe your diet?
Well, I eat healthy.
Thank you for your information. Mike, I'm just going to document this on your profile and update it. Is it okay if I take a moment to check my reference very quickly?
Sure.
Thank you. So now at this time, everyone, we have a reference for testosterone. Ideally, you want to take between 1.5 minutes to 2 minutes to read the reference. However, 2 minutes might be a lot, so you want to cap it at 1.5 minutes. This is where a lot of students do get pressurized. Keep in mind the timer is still running. So during this time, you have to open the reference, go through it, find whatever information you're looking for, and then come back to the actor and address any questions or concerns they may have, or add on any information you may have needed. So now upon checking my reference, I come back and I say, thank you for your patience, Mike. According to my reference, testosterone is not indicated for everyone. It's usually used for patients with low testosterone or a condition called hypogonadism. And the recommended dose is usually about 200 milligrams, which is about 2 ml, every 2 weeks into the muscle by a healthcare provider, with a maximum of 4 ml or 400 milligrams per month. Now, in your case, Mike, you are using beyond the maximum dose, and that is quite concerning to me.
So what could happen to me if I took these doses?
Yeah, so that's a good question. If you take too much of a dose, over time it can damage your liver, it can cause mental health issues, it can lower
5
your
minutes
mood,
over. 2 minutes to go.
and cause hallucinations, and in worst case scenario, it can lead to a stroke or even a heart attack. And these are some of the things that may happen. I'm not trying to scare you, but I want to make sure you're aware it can also cause a risk of dependence.
What is dependence?
Well, since you're taking a higher dose than recommended, when you decide to stop this medication, your body might go through something called withdrawal due to the dependence because it feels like it needs the medication when it doesn't. You might experience restlessness, low mood, even impact your sleeping. And these symptoms may last for weeks to even months.
Wow. All these things?
Yeah.
I didn't know, honestly.
Okay, and given this information, do you still want the syringes?
Yeah, but I want to stop also. What will you advise me, please?
Well, what I would advise you first off is to speak to your family doctor or a physician about this, and they do have to speak to you and monitor you as you get off this medication. For now, since you are here for the syringes, I will give them to you, not because I'm encouraging the use of the medication, but you mentioned your friends may share needles. And
Mhm.
for that reason, I want you to give these syringes to your friends and even explain to them if it's possible for them to come in, and I can even discuss this with them as well to make sure they're making informed decisions. Is that okay?
Yeah, thank you so much. And I will book an appointment with the doctor as soon as possible.
That's great, Mike. I really appreciate you coming in today. Is it okay if I give you a call in maybe 2 days to see what the doctor said during your visit?
Yeah, absolutely. Thank you so much again.
Thank you so much, Mike, and have a good day.
You too.
So that is the case, and there were still about 40 seconds left on the clock. So 6 minutes and 20 seconds. So in this case, it is a bit more complex than what you would normally see in a few cases, but the PBC exam does reflect this, right? On the exam, you may get a few easy cases, you might get a few difficult cases, but the idea is you must be able to address any case that comes up and do not get overwhelmed with the type of case. Usually, testosterone, since it is a controlled medication, does get people anxious or nervous because it is intimidating. But as you take it, if you follow the approach that SolRx teaches you, approaching these types of cases becomes very easy. You might be wondering, how did I organize myself? The reality is, I use the acronyms that we utilize in this course. And here is an example of a assessment sheet that you get with our course. So you will notice here that the assessment sheet is quite detailed. If you go on PBC's website, our assessment sheets actually mark you similarly to how PBC marks you. PBC looks for communication, they look for outcome, and they look for performance. At the end of the day, this is what you also get assessed on in SolRx. You'll notice here that the assessment sheet is out of 15 points. Your performance depends on how many points you get out of these 15 available points. Your outcome is dependent on the solution of the case. Were you able to identify why the patient uses testosterone? Were you able to fix what the problem was? Here, the problem was education. So I had to provide education to Mike to ensure that they are aware of the consequences of using testosterone. And then, of course, you get marked at communication. How well do you speak? Do you show empathy where needed? Empathy may not be used in every case, but in some cases it can be used. Are you using the right language, your grammar, your sentence structure? Are you having a variation in tone? your body language. A lot of people assume that OSCEs is all about talking. It's not only about talking. It's about how well you are sitting down. Is your back upright? Are your feet planted on the ground? Are you shaking your legs, showing off a little bit of nervousness? Are you very confident when you speak? Are you maintaining eye contact? All these things may sound very particular, but these are things that you are trained on in the course. You'll also notice at the bottom there's a competency section. As we mentioned, PBC marks you on 9 different competencies, and so do our cases. You get marked on patient care, knowledge and research, how well you're utilizing the reference, communication education, intra and interprofessional collaboration, product distribution, and health promotion. It's a very detailed assessment sheet, but this is how best you learn how to handle and tackle these cases. You will also notice there's a section here talking about misinformation and risk. Why? Because on the exam, according to PBC, if you put the patient at risk or you provide misinformation to the patient, it will drastically impact your score. It might take you from a level 4 all the way down to a level 2 or a 1 because now you are giving information to the patient without the facts straight and you're potentially putting them at risk. These are things you must keep in mind. If you have any questions, continue asking them. Mo is there, Hyung is there, Ella is there answering any questions you guys may have. And then at the end, any questions particular to myself or Vipul, we will answer them during the Q&A. So for now, we are going to do another case performance. This is going to be done by Hyung and myself. I will be the actor. Hyung will be the pharmacist. Now let's break down the door note together just like last time. Here it says you are a pharmacist on duty at a community pharmacy. A person is coming for advice. Now you'll notice that the door note doesn't really give you much information, all that you're in a community pharmacy setting. Sometimes the setting could be hospital. It could be long-term care home. But all we're getting from here is a setting, which is community pharmacy. However, in references, you'll notice this time it only says patient profile. That means there is no reference. There's no external reference there. So all you really have during this case is the patient profile and our brain. We have to be able to identify the problem, solve the problem. You'll notice that these cases without a reference, they are very heavy in information gathering. We are going to demonstrate it here right now. So similar to the last case, I will turn off my camera. I will start the timer. Hyung will be given 20 seconds to read the profile, understand the profile, and scan the profile. Profile scanning is essential, and that is also something we go in heavy detail in the course. Okay, Hyung, ready?
Yeah.
All right. Your time will start now.
Station started.
So for this 20 seconds, I'll take the moment to go through my profile to understand what comments mean, what are those drugs, and what are the when did they fill, how much quantity, and all those things.
Hello.
Hi, my name is Hayoung. I'm the pharmacist on duty. How can I help you today?
Hi, I was wondering if you could recommend something for my wife. She's been feeling very weak and very tired recently.
Oh, it must be very hard for you and your wife. I'll see what I can do for her. And in order for me to do that, I'll need to ask a few more questions to make sure I make the best recommendation. Would that be okay?
Sure, go ahead.
Okay, please have a seat. This is our private counseling area. Whatever we discuss here will be kept private and confidential. So first of all, can I get her full name and the date of birth?
Her name is Jennifer George. She's 31 years old.
Okay, and how may I address you?
My name is John. I'm her husband.
Okay, so I have Jennifer's profile here, and I see that she gave a written consent for you, John, to deal with her healthcare matters. So you said Jennifer is feeling weak and lethargic. Could you tell me more about it?
Yeah, so I'm not sure what's going on. She just has less energy and feels very irritable.
Oh, I can see that you're concerned. I'll do my best to figure out what's best for her. Any other symptoms?
No, that's all I can think about. Just very tired and low energy.
Okay, anything else you'd like to add?
No,
Has she seen a doctor for this?
no,
Has she tried anything?
no.
How long has she been feeling this way?
It's been a couple of months now.
Okay, is it her first time experiencing this symptom?
She felt these symptoms about a year ago, but then
Okay, okay, did she try anything that time then?
last year she saw the doctor and the doctor started her on some iron pills. She took them for a while and then the symptoms went away.
Okay, and has she done any recent blood work?
No,
Okay, and anything changed recently? Maybe something in her lifestyle?
No, she just recently switched to being a vegetarian about 3 months ago. That's about it.
Okay, I'll note that down. And has she noticed anything that makes it better?
No,
Anything that makes the symptoms worse?
no.
Okay, thank you so much for answering those questions, John. I'd like to verify some of the information that we have on Jennifer's profile. Would that be okay?
Yeah, go ahead.
Okay, it says no known allergies. Any updates on that?
No updates.
And I see here that she has some sleeping problems. How's her sleep cycle now?
It's actually really good. Ever since she started taking the sleeping pills, it's been better.
Okay, I don't have the pills on her profile. Do you know the name and strength of the medication?
Yeah, she actually gets it from a different pharmacy. It's Zopiclone 7.5 milligrams, and she takes it once daily. However, she stopped taking the pill a while ago as she doesn't have the sleeping problems anymore.
Okay, I'll update that on her profile. And I can also see that she has a history, sorry, of low iron and excessive menstrual bleeding. Is that information correct?
Yes, that's why she started taking iron a year ago.
Is that iron pill that you mentioned Palifer?
Yes,
Okay. And you mentioned that it worked well, right?
that's right. It worked well, and she felt good for about 3 months after using the medication for 3 months, and then she stopped it.
Okay. Okay, so you said that she stopped it, and I also see that her last refill was a year ago. Did she see a doctor before stopping the medication?
No, she just started feeling better and she stopped taking the pills.
Okay, I'll update this on her profile too, but it's very important for her not to stop iron pills by herself without talking to a doctor, as it can take quite a bit of time to replenish all the iron in the body. Am I being clear so far, John?
Yeah, I didn't know that. Thank you for telling me.
No problem. So does Jennifer have any other medical conditions?
No.
And I see that she's taking at least 28. Is she taking it regularly?
Yeah, she takes it for birth control.
Okay. And since you said she's taking it regularly, is it safe to assume that she's not pregnant?
That's right, she's not.
What about breastfeeding?
No,
Any side effects from the medication by any chance?
she's good.
Okay, that's good. Any other prescription medication she's on?
No.
What about over-the-counter medication, Tylenol, Advil, herbal supplements, vitamins?
No, nothing else.
Thank you so much, John. And I'd like to ask a few lifestyle questions as they can impact the medical condition. Does she drink any caffeinated beverages, coffee, tea, cola?
No, no coffee.
What about alcohol?
No.
Does she smoke by any chance or any recreational drugs?
No, no, she's not a smoker and she doesn't use any drugs.
Okay, does she get some time to exercise?
Yeah, she's usually very active, but recently because she's tired, she hasn't been going to the gym.
I see. And you mentioned that she's vegetarian. Does she see a dietitian?
No.
Okay, thank you so much for all this information. Do you have any other concerns that you would like to me to address?
Well, can I get a refill for the Palifer? Maybe that might help her.
Okay, I just need a moment to collect my thoughts. I'll get back to you and I'll answer your question.
Sure.
Okay, so I'll take a quick moment to think about what should be the best approach. And thank you so much for patiently waiting, John. First, I'd like to appreciate you coming to the pharmacy for advice. Unfortunately, though, I wouldn't be able to dispense Palifer for Jennifer right now without confirming with the doctor.
5 minutes
I'm
over.
glad that it worked for her in the past, but we cannot be sure whether it is the same condition, first of all. And even if it is the same condition, low iron in the body, we cannot be sure if the medication and the strength is right and appropriate for her. And doctor is at a best position to decide.
I understand,
And
but what's the
yeah,
harm if she just takes it?
well, John, because the excessive iron in the body, it can be harmful and may lead to conditions such as liver damage, heart problems, joint pain. So she should see a doctor to get an assessment so that we don't overload iron if it's not needed in our body. Am I being clear?
Yes, I see. I'll make sure she goes sees the doctor right away then.
Yes, sounds good. I'll document this on her profile and I'll fax the doctor as well. And since she's a vegetarian, there can be some nutrients such as iron that she may not be consuming adequately. So I strongly encourage her to see a dietitian to get an appropriate diet plan for her. And also like to remind you that, as I said, it's not a good idea to stop the supplements without speaking to the doctor if it's instructed from the doctor. Okay.
I understand. I'll make sure she sees a dietitian and the doctor.
Okay. So is it okay if we give Jennifer a call in a day or two to see what the doctor said?
Yeah, that's fine.
Okay, all right, John. Have a great day.
Thank you. Great job, Young. So that was 40 seconds remaining as well. So very well done. And that is pretty much a case about information gathering and explaining and educating the caregiver in this case about what's going on with their wife and potentially what the next steps are. So I'll let Young talk about the assessment sheet here very briefly before we talk about what the course has to offer beyond this.
Yes, so iron pill. So anytime someone comes in with certain symptoms, although this case heavily is related to profile reading, we have a certain structure that we have to ask, which will be any symptomatic related questions. Any, did you see the doctor? Have you tried anything? And anything that makes it better, anything that makes it worse? Can you describe the symptoms? Although it may seem like she's experiencing low iron or iron deficiency due to potentially being a vegetarian, we must ensure that we ask all those questions to, to first of all, demonstrate that we know what are the important questions to ask. And second, as we talked about earlier, answers to some of the question or even a single question can completely change course of your action. So we do have acronyms, as we talked about, so that you don't forget what are the questions to ask when someone comes in for OTC medication. And you may have a question thinking, hey, iron pills are scheduled to, why do we need to send her to a doctor? So just to briefly address the answer to this case is that iron, over-the-counter iron pills, or what pharmacists usually keep it behind the counter, they have a potency difference that is in tenfold, hundredfold. So we want to make sure that iron level is appropriate. Whatever product we're recommending is appropriate for the patient. So it has to come from a doctor. So PBC are testing those knowledge. Are you aware that pharmacists, although we have it as a behind the counter, it should be only after they talk to the doctor. So all those little things, and you may not be aware when you don't have pharmacy experience, and that's completely okay because we will provide various different cases which you'll be exposed to understand and know these important details. So this case is very heavily focused on understanding the profile, patient education, and understanding good interview skills and demonstrating them. Is there anything else that you would like to add, people or permit? And Mohammed and Ella too?
I can add a few more points. So basically, the advantage of working in a pharmacy and disadvantage of working in a pharmacy. What is the disadvantage of working in a pharmacy? If any of you are working in a pharmacy as assistant, if the person is coming, I need a pala for refill, do we ask this question? No. We just refill the prescription and here you go. We are harming the patient. Patient care is compromised. So this is the downfall of working if you're not doing exactly what PB's expectation is. Now, in our course, we are going to tell you the practicality that if what is happening in the pharmacy and what we are not supposed to do there. Of course, we are not criticizing any pharmacy there, but lack of time and nobody is watching you. There is no assessor there, so you get away. But in case if some complaints comes, you'll be in a problem. Same is that both the cases are like this. Any person coming for syringe, do you think that any pharmacy has the time to do what permit is doing? No, right? They say either we don't carry to get away with the problem, or they'll say here is a don't sir, and then you're gone, right? So this is what we are doing in a class. We are going to teach you that if you're working, please make sure that this is the steps is must in PBC. In the class, some people, some students may not be able to perform. So what we do, we perform on your behalf, how to do it, and we'll let you perform once again until you are satisfied. So quality and quantity, both we are doing it. So we know that what you need. So in each and every class, we perform, we have recorded cases also. So you know what is to be done. Now, testosterone, 20 pages of reference. You will be lost where to check. That we are going to teach you also that, okay, the person is coming for overusing the testosterone, using without prescription. So some general knowledge will come in picture and which section you should go to educate the patient. So this is what we are explaining each and every class. It is recorded, you can listen, and our process is we don't tell listen, take it or forget it. No, we'll explain with logic until you are satisfied, because you must be having so much of a experience of MCQ, but sometimes you don't have to use all what is required for OSCE. So we'll give you a process, we'll give you a formula for it so that even the case they change, you can solve the case. This is what SolRx is doing it. Go ahead, Pamit.
Thank you, Vipul. So before we move on to a few more details of what the course has to offer and success stories, I'm going to let Mo share a little bit of insight that he wants to add on to.
Yeah, so during the OSCE, and as Hugh Young and Parmit mentioned a while ago, it's all about practice. So you need to practice, practice, and then even practice even more. Okay, keep this in your mind. Choosing your partner, study partner, is really critical. He could be the reason for your passing or even failing. Don't choose a partner that is your best friend, that because he will not give you the right assessment, that or he won't point to the weak points that you have or your mistakes. Make sure to practice with different students for now, and with the large number that you already signed with, and we categorize every student in each day that they are taking the classes with us. You can find a lot of study partner. Even our Telegram group, you can find study partners that you can practice with. Long story short, make sure when you are choosing your partner to choose from different gender, from different age group, from different background, because that is the same thing that you will face in the exam itself. You will have students from different backgrounds, actors from different backgrounds, different ages, and that's what you want to be ready with. Even our mock exam in the future, if you guys decided to sign with us, you will find that we try as much as possible to provide the actors with different background, as I mentioned, even ages. Okay, some of them are pharmacy professionals, some of them are not. This is exactly what you will face in the exam. So that's what I want to share. Thank you so much, Parmit, for giving me the
Thank you,
mic.
Mo. So we're going to move on. We want to share some success stories from our past students. So you have a bit of an idea. These past students, their names are Fajero and Anam. Again, I'll let them do the speaking, and we'll go from there.
Hi, my name is Frederick Penny, and I'm originally from Nigeria, but I currently live in Canada right now. Now, before I took the OSCE exam, I worked as a research assistant here in Canada. And back home in Nigeria, I worked as a community pharmacist and also worked as a clinical pharmacist in a hospital setting. Now, I attempted the OSCE exam earlier on, and I was unsuccessful. I used another prep course, and I decided to give SolRx a trial because a lot of my colleagues and friends had recommended this prep course to me. Now, I took the prep course with SolRx in August 2024 as I was hoping to attend the exam in November 2024. I was looking to gain a lot of knowledge from SolRx and also address the issue of being anxious and nervous whenever I walked into any station during the exam. Now, the previous prep course I took, I wasn't able to pass the exam with them. And not only that, I was not happy and was unsatisfied with how the preparation went. So I decided to give SolRx a trial. Now, the issue of anxiety was greatly addressed during this course preparation, and they were able to help me in so many ways. We had hands-on practice where you would practice in front of your colleagues and other people, and it was usually simulated to look like the real exam. So it helped me to actually address that nervousness and anxiety I felt for every station. Now, in addition to addressing my anxiety, they also taught us a lot about the different stations we would experience while we were in the exam. Now, a lot of things were given to us to practice with. We had so many stations and so many examples to practice with, and Vipul and Pamit were able to guide us, giving us hands-on experience on what we were supposed to do. Even if we did not get the station right, the way we were corrected would completely stick with you. And that was something that stood out for me. So two things: addressing my anxiety and nervousness, and also giving us a whole load of cases to practice. Now, I'm very thankful because I was able to pass my exam. One thing the course helped me do was be more confident. I was nervous quite all right a bit about going into the exam, given my previous unsuccessful attempt. But with the level of preparedness I had with SolRx, I was more confident than the last time that I was going to pass the exam. And I did pass the exam. Now, my plans for the future are to complete the licensure process so that I'm able to practice as a pharmacist fully here in Canada. And I have stayed in contact with SolRx because this is an amazing institution, and I am willing to volunteer and give my services in any way that will be able to help other students, especially international graduates like myself, to pass their exams. So if you're looking for a way you could actually do this, it doesn't matter where you're from. There are people who didn't know how to speak English fully, people who didn't have so much Canadian experience, and they were able to do this. So that is my story, and I'm really grateful and thankful to SolRx.
Thank you. So that was pretty much a very short testimonial from Vajero, one of our amazing students. And she pretty much spoke for herself in terms of what she got from the course. Now, before we move on, I do want to share one more success story from another student, Anam. She's actually a graduate from London, so in England. So she came from there. Now she works in a hospital in Canada, in Ontario. And one question I usually get is, can international pharmacists ever get a job in industry or hospital? Yeah, it will be difficult, but the answer is yes. It is possible through the right networks and the right means. And of course, depending on the type of person you are and how well you are able to kind of portray your skills and your abilities as a hospital pharmacist. So here is a quick testimonial from Anam.
Hi everyone, my name is Anna. I studied pharmacy school in the UK, and I took the SolRx OSCE course in November to challenge the November of 2023 OSCE and MCQ exam together. And while I was studying, I was also working at Shoppers Drug Mart as a pharmacy assistant, and I was so grateful for the SolRx course, especially for OSCE, which is a challenging exam, especially if you're an international graduate, where it's hard to visualize what the stations would be like, how to challenge clinical scenarios and everything like that. So the OSCE course really helped me prepare for that, visualize what the OSCE would be like, and also get loads and loads of practice with the different types of cases. So when I went to do the actual exam, it felt like, oh, this is like one of the SolRx cases that I did. So it made things much, much easier for me. So just to briefly share a little bit about my journey and some challenges that I faced during this journey, I took this course because I didn't really know what the OSCE would be like in Canada. And my biggest fear during the OSCE was I would run out of time because I have a lot of questions, and I didn't have any structure, and I didn't know how I would ask the questions and how I'm able to get all that information in 7 minutes and provide a solution. So SolRx not only gives you a way to structure your question, but it makes sure you hit all the points and you don't miss anything critical. And that's really, really important during your OSCE, time management. So that's something I struggled with, and SolRx greatly helped me with that, with their acronyms. And we got loads of practice to use those acronyms to kind of make sure we hit all the points. And that was pretty much what I was hoping to get out of it. SolRx really helps me even beyond me passing my exams in my first attempt. I still refer back to the notes time to time and look at the cases and revisit some of the acronyms, especially in my counseling when I was working in community. I'm working in hospital right now, but when I was working in community, it helped me a lot as well with counseling patients, and I still use them to this day. And after coming out of the OSCE, not only did I feel confident, but now as a pharmacist, I feel more prepared. I know how I would deal with patients, and I think it made me much more confident overall as a pharmacist. So highly recommend this course. And in terms of my future plans, I'm currently working at Victoria Hospital in London. So I hope to stay here for the next few years of my life, as I've always wanted to be a hospital pharmacist. This really helped me because I think the OSCE course really helped push me as one step forward. So it helped give me a competitive edge in terms of my counseling. It was much more refined as an international graduate. So I think SolRx courses definitely put you up there with the Canadian graduates. So I highly recommend that. And am I involved with SolRx? Yes, absolutely. So I'm involved as not only an alumni, but I also helped with developing the MCQ course and developing the questions and helping students, because that's something I really wanted to do, help students with cases and also kind of present the relevant knowledge, because I've only recently finished my licensing exams. So I think I was in a position to help students. I'm definitely involved with SolRx because I think it's such a fantastic course. So both the OSCE, the MCQ course wasn't there when I was studying, but I highly would recommend it for anyone. So yeah, I would say keep SolRx in mind when you're there and on this journey to passing your exams, because not only does it help you pass your exams, it helps you become a great pharmacist. And I'm so grateful for SolRx. All right, everybody, all the best and see you on the other side.
So that was one of our success stories for Anam. And that's something that we really appreciate, is that sometimes students like Anam end up becoming faculty. She is one of our MCQ instructors for the hospital section of that course, as she does have hospital experience now. But these are one of the things that we are very proud of in SolRx, that you're not really just a student in SolRx. Eventually you do become family, you become alumni, and depending on what your career goals are, sometimes we can help you obtain jobs around the country. We have many connections with various pharmacies throughout the country in British Columbia, Newfoundland, Nova Scotia. It varies. And then if you have a passion for teaching, sometimes you can even join the SolRx team in other ways and help out in other ways and help other international students kind of get their careers lined up as well in the future. So that is something that we are very proud of within SolRx, is the community that we built. Now, what are the OSCE course details? So let's get into the nitty-gritty of everything. So we mentioned to you that you get tons of books throughout this course. And there was a question that was asked earlier. Do you need to refer to other books outside of this course, such as the CPS? The answer is no. Why? Because our books are created keeping everything in mind. The guidelines, the CPS, everything is kept in mind when creating the SolRx books. We also provide you hundreds of references to use throughout your case practices. Sometimes you practice cases in class. Sometimes you get cases for homework. And then each case has accompanying references, depending on the case, of course. Our books teach you how to utilize these references. On the OSCE exam, it is very possible that they give you a brand new reference, which was published 2 months ago. But the idea is you don't need to memorize any references or any scripts for OSCEs. You need to have a toolkit ready so you know how to utilize these references. So in our course, we have 6 books and we have a handbook. Book number 1 is our orientation plus interactive case book. It kind of goes through the gist of OSCEs, the type of cases you would expect, the nitty-gritty details of every single case, and it has interactive case practices. This is just an addition to what you get in class as well as homework. And these interactive cases within the orientation book fall under the category of multiple types of cases. It could be a doctor case, could be an OTC case, so over the counter, could be regular counseling. And each case has accompanying videos that you can watch of the faculty performing these cases, similar to how you saw us performing it today. Book number 2 is our non-interactive case book. This is basically the CTMA, so your minor ailments. There's over 140 topics in minor ailments.
Okay.
Oh, sorry, that's book 3. Book 2 is non-interactive case practice. Book 3 is minor ailments. And in minor ailments, a lot of people assume that you have to memorize these algorithms. The answer is yes, to an extent, that you have to understand the algorithms. You must be able to assess a patient as they come to you. Because on the exam, sometimes you get a case where there may not be a reference. And sometimes that may be overwhelming. But the idea is through book 3, you get that practice. You understand how to approach these over-the-counter cases. Book number 2, sorry to go back to one step, but book number 2 is non-interactive cases. This is pretty much dispense checking, prescription screening, a lot of practice on how to handle these types of cases. Non-interactive cases are often overlooked, and unfortunately, it can be the reason some students fail, because they spend 100% of their time studying interactive cases, but in reality, you have to put similar to equal amount of time in non-interactive cases as well. I always like telling students that when you see a non-interactive case, you should feel like it is a rest station. That's how confident and prepared you should be for those types of cases. Book number 4 is going to be general knowledge. This kind of goes through the gist of many different therapeutic or disease management It talks about side effect management, talks about self-care tips for many conditions. That's book 4. Book 5 is reference checking practice, focus on RX vigilance. If you guys work in Shoppers Drug Mart, you are very familiar with RX vigilance. If you don't, RX vigilance is a reference similar to what the CPS is, but its own type of reference published by different people. Now, at the end of the day, PBC loves to use different types of references. So recently, over the last few years, they started using RX vigilance. But the good thing is our course has actually been using RX vigilance beyond that. We've been teaching students about RX vigilance for 6-7 years now. So when it came up on the exam, our students were not worried about anything. This is what I meant when Vipul said that our course is proactive. We teach you things that the PBC hasn't done yet because we know the trends. We know what they're going to do. We have an idea of what can potentially come up on the exam. And for that reason, we always go above and beyond and teach you beyond what's expected of the exam. So in case something does come up, you know how to handle it. Book number 6 is going to give you counseling practice for both over-the-counter as well as prescription medications. So this is not meant to be something you memorize, but is meant for you to practice counseling medications within 1 to 2 minutes. Remember, we have a 7-minute window. How you utilize every single second in that 7-minute window is very important. We break it down for you. We tell you that you should spend 2.5 minutes on information gathering. You should spend 1 minute on reference checking, 2 minutes counseling the medication. You have a few minutes to kind of gather your thoughts. Every single point or every single second is explained and taught to you. Then we have our acronym handbook. This acronym handbook is going to serve as a guide on how to tackle the variety of cases. We love using acronyms because acronyms keep you structured. It keeps you organized. It has a flow. Of course, some people may not do that well with acronyms. They have their own methods. But the idea is the acronym teaches you the base. It gives you the foundation. Beyond that is usually dependent on the individual, how they utilize them. Okay? Now, our course for November, the schedule is already posted on the website. We have online and we have on-site classes. Online classes happen every single day, Monday to Saturday. They happen in the morning and they happen in the evening. So it is very flexible according to your schedule. You would sign up for one of the days and you would repeat these days every single week for 9 weeks. So you get 9 live sessions with your enrollment, including the books that we talked about, including the 24/7 support. If you decide to go for on-site, we are actually located in the GTA, so the Mississauga area. You can see our address is 105-1065 Canadian Place, located in Mississauga near the airport. Our on-site classes happen on the weekends, Friday, Saturday, and Sunday, from 9 a.m. to 4 p.m. We always urge anyone who is within the area to sign up for on-site classes. But if you're not in the area, just note that the online classes provide you equal opportunity and benefit and exposure to the cases and instructors. We make sure that you are not only being taught by one instructor all the time. You are getting exposure to all the instructors you see here today. And the reason, as Mo mentioned before, on the exam, you are going to get a different actor and different assessors for every single case. You should not be too comfortable with one person. Every assessor here has a different background, has different experiences. And we make sure that we are sharing these experiences and these skills to you. At the end of the day, you are going to be a combination of all of our experiences. So what makes SolRx so special? We provide scripts, we provide assessments. The scripts are there for you to understand what is the general expectation. But remember, you are never required to memorize scripts. These are just there so you can practice with one another. At the end of the day, how you perform should be based on the guide that we give you. Never memorize the answers. Hayoung mentioned before, PBC loves to bring back some old cases, but they change 1 or 2 words. And I have seen that in my own exam as well. You will get over 250 practical cases, over 200 brainstorming cases. What are brainstorming cases? They are basically shorter cases, so you kind of get an understanding of what a possible OSCE case could be or what are the outcomes. You get over 60 non-interactive practice cases. It is a small class size, even though there may be hundreds of students In the course, your class size is going to remain between 10 to 11 people. And the reason we keep it like this is you get that one-on-one interaction with the instructor. OSCEs is all practical. It's not like MCQ. You cannot sit in a classroom full of hundreds of people and learn. You have to have that one-on-one interaction with the instructor and with your peers. You get one-on-one assessments during class, both verbally and written. You get the verbal feedback, and then you get the written feedback, which you see an example of on the right side, where we would write it out on how well you performed during a case, and we would send it out to you after the class. You get the in-depth analysis, and sometimes, if needed, if the case is very difficult, we perform the case for you live on the spot to make sure everyone understands and there's no gaps in anyone's knowledge. And then, of course, classes will always be recorded, so you can access them within 24 hours in case you want to brush up on something, or by the circumstances, if you missed the class, we will try our best to accommodate, but recordings will always be there to ensure you can go through it and understand and watch a performance. The one thing I love about recordings is I always ask students, look at your class recording from class number 1 and then go back to class number 9. And then you be the judge of it yourself, how much improvement you see. And that is something, again, we are very, very proud of when it comes to this course. Vipul mentioned earlier on that we have a system, a process on how we can progress, or how we can check your progress throughout the course. There will be weekly checklists that you utilize as a study planner, and then the assessors and the instructors will try their best to go through with every student through the digital online forms to make sure everyone's on track. And whenever needed, we are always going to be there for you to provide feedback and give more tips. You get individualized reports at midpoint as well as the final mock exams. For example, on the right side, you can see a midpoint evaluation. Now, it's not going to be impossible for someone to get a level 4 excellent at midpoint. However, most of the times there's always room for improvement. And we always make sure we pick on those points and explain to the individual how best they can improve their performance for future classes. At the end of the day, our goal is simple. We have one goal in this course, and that is to make sure you pass the OSCE exam. And of course, we can be there along the way. But at the end of the day, it is how much effort you put in, and we are going to make sure we put in the effort. We give you the guides. All you have to do is follow them and practice, because without practice, it is not going to be possible. After the course is done, there will be some time between the last class and the exam. We are going to make sure that we create a study guide for you on what you should do on a weekly basis when preparing during the last 30 days or so, because those 30 days are going to be crucial. Someone once asked me, how much time do you have to put into OSCE prep? It's not 1 or 2 hours. It's like a full-time job, but you are able to do it at your own time, at your own pace. And the best thing is you have a guide and you have a structure to follow if you enroll in the course. One other thing that we pride ourselves the most is our support. We have a WhatsApp group that is monitored 24/7. We always tell our students that response time is less than 24 hours. However, most of the time, depending on the day, depending on the availability, we have assessors and instructors who are monitoring the group at all times, and they respond to you very quickly. But the general rule we always give is within 24 hours, you will get a response. But it won't be just any regular response. We respond ideally, if needed, with a reference after doing thorough research, if needed. If it's a simple question, we will answer it. But if it's a question that requires us to go and do some research, find the reference, and explain using the reference, we will make sure to do that. At the end of the day, like I said before, we have one goal, and that goal is to make sure you pass the OSCEs. One thing I do want to mention is that registration for the course is open. Seats are filling very, very quickly. Most of the study material is available right away, so you can always access it as soon as you register. This includes the books. If you are planning on taking the MCQ and OSCE together, you can always call us and we have a special deal for you. If you want more questions or queries, you can always email vsolrx@gmail.com. But at the end of the day, we offer not only OSCEs, we offer MCQ as well. Our MCQ course is very different. It's a 14-week long course that gives you 2 classes a week. More information can be found on our website, or again, you can reach out to us and we can discuss later on. We also do have a February schedule because we know that there is going to be an additional OSCE exam in February 2026. Now, keeping in mind that if the exam is in Feb 2026, we want to start preparing a bit earlier. So the schedule that I showed you before was the preparation schedule for the November exam. Now here is the schedule for the February exam. We will have, again, online and on-site. What you see in front of you is the on-site schedule. So it will happen Sundays weekly. It will start in October and it will end mid-December. There will be a 2-week break between week 3 and class number 4. The reason is PBC exams will be happening at that time, and we understand some people are writing the MCQ in November and some people are writing the OSCEs in Feb. So we want to make sure we don't interrupt anyone while they're doing their exams. When it comes to the online schedule, we are again going to do it regularly, Monday through Saturday, in the mornings from October all the way to mid-December. So both online and on-site will be available for the February exam. Again, seats are filling up very quickly. You can always view them on the website. So if you want to enroll, earlier the better, and that will ensure that you get a spot in the course. Now, there are some questions that we usually get, but before we talk about the frequently asked questions, our mock exam schedule for both the November and the February exam are also available. Mock exams happen on particular days. With the course, you get 1 mock exam included. If you want additional mock exams, you may purchase those at additional fee. Everything is available on our website, as well as the dates for the particular mock exams. Now, what are some frequently asked questions that we get often? A lot of people are telling me that they're waiting for their MCQ result, which is coming out July 7th. However, since the July 7th MCQ results and OSCE results come out, usually OSCE gets filled up that day, realistically speaking, and it's very difficult to get enrollment after that. So the best way you can do that to secure your spot is you can do a pre-registration deposit, and you can always pay that, which is $200, to vsolrx@gmail.com through e-transfer, and the balance will be due after the MCQ result comes out. God forbid, if the MCQ result is not to your favor and you do not pass, there are 2 options we give you. Option number 1 is you can keep your spot for the Feb or the May 2026 exam, so you can prepare for that course, or you can request the refund of the $200 deposit and we will process it within a week. So we are not going to keep any amount. The $200 deposit is just to ensure a spot for the course if you are waiting for the results to come out. A question we got earlier was 3 months enough to prepare for the OSCE? So this question, I believe, was asked on the chat not too long ago. The answer is yes, but only if you follow our instruction to the T, 100% of the instructions, and study about 25 to 30 hours a week. If you are not able to do that, then we recommend enrolling for the February course, because that will give you a bit more time. If you start preparing now, that will give you 6 months. However, if you are planning on writing the November course, 100%, it is very possible to start studying now or a few weeks from now, as long as you have at least 3 months and you are ready for the November exam. Do you need any other extra material? No, you don't. We provide you everything you require for the exam. No additional purchases will be required. However, we do offer 1-to-1 sessions should students need it in the future. We always have those sessions available at an additional fee. That's where you would actually sit down with an assessor or an instructor, one-on-one, literally just one person and you will get a chance to practice furthermore. And then additional fee would be additional mock exams should you want more than what's already offered, which is the 1 course. Do I need to print all the materials that we provide? Most of them, yeah, you should print them. However, PBC may provide electronic references in the future. If you go on their website right now It does say that most references are printed. However, it can be on a handheld device. They haven't done this so far. They've done it once a long, long time ago, but it is very possible that they might put a tablet, for example, on the exam, and you have to utilize a tablet to scroll through the reference. Another question is, can I postpone my course to February 2026 or May 2026 after the classes begin? The answer is no. If you enroll in the November exam and classes have already begun, then you will not be able to postpone it. However, you can postpone the mock exams without any additional charges. Is there a refund policy? After registration, since you receive the materials right away, there is no refunds allowed because you get access to the materials right away. So we always make sure if you have any questions about the course or if you want to clarify any concerns, it's best to contact us and we will make sure we address all your concerns before you register. Why does the February 2026 OSCE course start before we get the November 2025 results? Because taking the OSCE courses helps you not only for OSCEs, but also for MCQ. You'll understand the pharmacy flow, you'll get a bit of an overview for OSCEs, and this can be utilized to answer management-specific questions in the MCQ. So at the end of the day, there will be a slight overlap between, whether you're taking OSCEs or MCQ, but at the end of the day, both courses or all courses complement each other because the exams also complement each other one way or another. And that is pretty much what we wanted to share with you today. So now we will open up the floor to any questions and we will try to answer them all.
Can you show the November batch class schedule again, please, Permit?
Yep. Here's the online one for November. So Doa is asking, can we access the course early and take live classes in Feb for the Feb batch? The answer is yes. So if you enroll in the February course, exam course, you will get access to the books right away, but the live classes will happen when those classes are scheduled to happen. So someone's asking, if you reserve a spot, will you get access to the materials? The answer is no. Reserving a spot, the $200 deposit will give you a spot in the course. However, to access the materials, it would happen after the payment is received in full. Sarah, you have a question? You can unmute yourself and ask if you want.
Yes, hi. So my question is, I already registered for the November for the exam and registered with you. My question is, like, as a mom, as a full-time work, uh, um, I will start like with you. So I'm not sure if it will be enough or not, but just in case, if I want to postpone the exam for February, is it possible, like, what will be the process? Like, I will finish in October and take the mock, and then I need to continue with you until February. So do I need to register for the February with you right now?
So as far as my understanding of your question is, you may take OSCE in February, right? That's what you think.
No, I registered for November, but I'm not sure. Like I'm just in case if I postpone the exam.
So that's what my question is. You want to take the classes now and you want to postpone your OSCE exam in February, right?
Uh, Not that like I will try my best to attend the November, but you never know. Maybe a day before the exam I will postpone. I'm not sure. So just in case, if I postponed in February, do I need to register with you or just to finish my November patch with you?
Yeah, that's what we answered in the frequently asked. Once you start the course, you have to finish all 9 classes. So you'll be having a recording, you'll be having everything. So there is no point attending the classes again for February. You can postpone your mock exam, right? There is no
Okay.
extra fee. So mock exam can be postponed because you want to take a mock exam near to February exam. That's the best thing to do, right? Not in November because you may forget.
Okay, I see. And the access for the online will be for a year?
Yes.
Okay, okay, because it show me like it will be expired in December.
No, it will be for a year for sure.
Oh, okay, okay. Thank you so much.
We are very flexible also, very
Mhm.
flexible. There are few students who are asking for 1.5 year because they couldn't take it because of pregnancy. We are very lenient. To add more points, how we are lenient. Sometime you are in Monday batch and you found out that you can't attend the classes on Monday. So we give a makeup class also. None of the last year or none of our students is without attending the classes. We are very flexible. But yes, not all the time. One or two times, exceptionally, we allow you to go to different batch as well, right? So this is what how flexible we are. So don't worry about expiring everything. Video recording every will be available until you pass, basically.
Okay, thank you so much.
No problem, Sarah.
So I see a question. What is the structure of the actual class? What do you do in the 6 hour session? So basically, it is going to be a lot of practical components of the 6 hour session. If you are wondering whether we're going to talk about theory, yes, we will talk about a little bit of theory in class if needed, but that's what the books are there for. The in-class sessions are mostly for practice. So for example, we will go through 20 different cases in class. We're going to make sure that everyone participates for each case once or twice, depending on how many cases we have for the day. But if we have 20 planned and there's 10 students, every student will perform 2 cases and every student will give feedback for most cases as well. So it is very practical and very interactive when it comes to the online sessions. The theory, majority of it is to be done through the books, but there are some classes where we dive deep into theory to talk and explain points that may not be clear for some topics. I hope that answered your question.
And then before the class, you come, we have a reference we are going to email, which will be available on our website. And we will give you a guidance that what to do before class 2, what to do before class 3. It is very much structured. And the cases will be discussed as if you are in the real scenario, no couch. There are some few housekeeping rules. Video should be, I mean, the camera should be on. Pencil, paper should be on. You'll be standing behind the chair as if you are in person. So if you're online classes, you'll have a feeling of on site. So we have lots of strict rule for your benefit. So you'll be doing same thing, but you lots of guidance. So basically, we are preparing food for you. We are laying down everything on the dining table. The only thing what you need to do is chew and swallow. That's what I can tell. Everything is very much prepared, very structured, very organized. Even if you won't know that, oh God, in 9 classes we covered everything. So you are really being a pharmacist, not only for PVC, but being a good pharmacist as well.
I see a question. Once the results are out, till when can we submit the full fee and get access if we reserve a spot? So if you reserve a spot, we will reach out to you once the results are out to ask you if you're going to go ahead with your reservation or not. Of course, we need to know the answer for this because if you are not planning on doing the course, we have to open the spot for someone else. So it would be as soon as the results come out, we will reach out to you. Ideally, within a couple of days, we need to know whether you're continuing with your reservation or you're not. I see another question. I'm writing the MCQ in November and I want to enroll in SolRx for the Feb batch. I know it might help with MCQ, but there is always uncertainty about the results. I don't want to miss an opportunity for Feb in case I pass, hopefully. So Reynad, if you do want to enroll for the course, by all means you should. When it comes to the MCQ exam in November, you are going to have a small little overlap with OSCE classes, but at the end of the day, they're always going to be recorded. So if you are spending 100% of your time studying for the MCQ, that's understandable, but you should still take a chance to view the recordings to catch up for the OSCE course. I hope that is kind of what you were asking.
The same scenario will be there. For example, you took again in February and you took the course for February and then you didn't pass in February also. So that same fee will be carried forward for May also, unless you didn't attend the class. So we are very flexible. Attending classes only once. That's the thumb rule.
So I see another question here. Someone told me since if you can't go on site, it won't be beneficial. Well, to be honest, we just did a case in front of you today through an online setting, and I'm hoping that provided some insight on what a case is supposed to look like. But if you're not taking the course because you're not able to go on site, then again, you're not going to have any structure. The online courses are the exact same as you would get on site. You get that same face-to-face interaction through webcam. You get that same one-on-one interaction by doing a case and practicing with the instructor. So whether you're doing it through webcam or you're doing it in person, it doesn't really make a big difference. Yeah, maybe the only thing I can't do or check is to see if you're shaking your legs or if your back is upright, your body language. Those are pretty much the only things as an assessor we can't tell if you're doing an online course versus an on-site. But everything else is pretty much the same.
Our statistics, 90% or the 80% are online.
If I may add,
Yeah.
my study partner, when I was a candidate for SolRx, my study partner took the course online. I took it on site. We both practiced through WhatsApp video calls, never met, and we both passed OSCE. So that's if that might help. That was my experience with my study partner.
See, this is the practical example, and our course statistics, our 90% or the 70% nowadays, because of 3 batches, we have running more than 25 or 30 batches. If you see from the schedule itself, there are 70%, 80% are online, and the success rate for both online oxides remain the same. So there is no difference at all. Yes, some people are there. I'm very nervous. Online, I'm comfortable, but I'm very nervous. I want to meet in a person. So that's a psychological effect, not the real effect. So yeah, if you are available, coming on site, 1% make a difference, but not much.
So I see a question. Doa is asking on-site are mock exams only in Ontario? So the on-site mock exams are only in Ontario for now. We may expand later on, but the online mocks can be attended from anywhere. So we do mock exams online as well. So if you want to attend from, for example, a different country or different province, by all means you can. It's the same experience. You will have different actors, different assessors, multiple rooms. All that will be managed by us. All you have to do that day is join the session just like you did today, and the mock exam will happen. Hyung, you want to add on?
Yes, how our mock exam works.
Hyung's just going to add something.
Yes, hi.
Yeah, I
Yes.
just wanted to add, online class, we can even figure out someone shaking the legs.
Yes.
We've been doing online classes through so many semesters. So now we have the sense that whether you're looking at the camera, so eye contact, whether you're taking good notes, we ask you to show your notes or take a picture and share with us. So we can instantly check how you're performing. So even the nonverbal skills. And just as what Ella mentioned, even if you attend in-person class, because everyone has such a different availability in their practice time, it will be difficult if you just want to stick with finding an in-person practice partner, right? So at the end, it's ideal if you have an in-person class and in-person practice partner, but that's going to be really, really difficult for every single one of you. I personally was an online student and I only had online study partner, but I strongly encourage on-site mock, and that was my first time practicing on-site. But you just need a couple rounds to get used to, so that being online, it shouldn't deter you from deciding a course or whether it's going to be beneficial or not. At the end, it's about your communication skills, your interview skills, your clinical knowledge, and thought process.
So, and you can explain more that how our online mock exam works, even though you're not missing the site also. So that you can explain.
Yeah, for sure. Yeah. So if you can come for on-site mock, that's great. But some people, it's just not possible. So we have online mocks. We have exact same number of cases that you will be going through on-site or online. You'll have a session half of the day, just bonus non-interactive cases. Half of the day, you'll have a full exact exam model. You will have rest station depending on the number of the student, which we can mimic the exam setting. You will be moved from one room to another room by our moderator of the exam that you will enter. You'll get same 2 minutes to read the door note on the screen, just like how we did. You will have an actor coming in after 20 seconds. Your assessor will closely observe you and you will perform as if you're doing the exact exam. And at the end of the day, the benefit of online mock is you will get to record your performance too. So you can look at it again and look at the feedback again and to take that extra. So that's the benefit of online. You're not missing out anything. Non-interactive stations will be there. There will be always someone to assess you and give feedback, and you'll get 100% same assessment. And our mock assessors have been doing this and been trained for to assess the students for a number of years with so many experiences, so that they will be able to give you constructive feedback for both online and on-site, as I mentioned, even nonverbal cues. Back to you, Parmit and Vipul.
Awesome, thank you, Hyung. So a few people are asking me exactly what do you get in the mocks. So just to clarify, every mock exam date is going to have a different mock exam. So you're not going to be getting the same mock exam. For example, if you come on Friday and you come on Sunday, they're going to be completely different mocks. You get 9 interactive, 2 non-interactive stations on the main circuit, which is pretty much 11 stations as you would on the real exam. Plus, we have a bonus session about 15 non-interactive cases, which will give you additional practice for non-interactive.
Same fee.
All within the same fee. Is working in pharmacy helpful for OSCE? If you work in pharmacy, it definitely does help build that communication, takes away that, that low confidence in case you are not someone who's used to speaking to others in a community setting, but it's not necessary, as we said earlier. But if you have the experience, by all means, it definitely does help. Lalita, the fee for mock exams is $450. However, with the enrollment of the course, you get 1 mock exam included. But if you want additional mocks, each mock will be $450 on top of the one that you get with the course.
Hello.
Yes, Uma?
The mock we are getting with the course, is it just online or it's physical too, or is it the two, the one that comes with the course? And also, if we are opting to reserve a space with $200, do we register on the website first before paying, or we just pay? Then where do we send the proof of payment to then?
Yep. So basically, the mock exam is your choice. Even if you sign up for an online course, you have the choice of on-site or online mock exam. That choice will be made closer to the course start date. You will be able to choose either one of them. So even if you registered for online, you can still register for an on-site mock exam. You get one, but either choice is yours. Now, when it comes to the $200 installment, a e-transfer can be made to vsolrx@gmail.com. However, if you need more information, you can contact us. Just go to the website, click the contact us page or link, or I can also post our number on the WhatsApp group, or sorry, the Zoom chat, so that way you can send a message on WhatsApp.
What's my number?
Okay, so you just pay without sending proof of payment to anyone?
No, we will send you an invoice, a proof of payment from our side once we receive it.
Okay.
Yeah.
Thank you.
What is the course fee and can we pay in installments? So $17.99 is for online, $19.99 is for on-site. If you're interested in installments, again, you would reach out to us via WhatsApp and we can discuss further. I will write down the number that you can reach out on the Zoom chat. That way you can ask questions and you will get responses promptly. If I chose the November 2025 course and changed my mind later on to take the OSCE exam in Feb, until when can I postpone my mock exam with SolRx? So before the mock exam date, you would have to let us know at least 1 month in advance. So if you want to postpone your mock exam, you will have to let us know at least 1 month in advance. Any other questions, anyone? I know it was a lot of information that we shared today. We are going to make sure that everyone gets access to the recording. If you visit our website, solrx.ca, you will see everything there, including the course fees, which I've already mentioned. Joe, the course fees is $17.99 for the online course, $19.99 for the on-site course. This is all in Canadian dollars.
We'll share the brochure also.
In the mock exam, you will have actors and assessors for these cases. So when you enter a room, there will be a different assessor and a different actor. It'll literally be like the real exam. Exactly what you will see on the exam is what you get in the mock exams. You will have 7-minute stations, 2 minutes between stations. You walk into a room. If you're on site, if you're online, you get placed into a separate room, and you will do the case with an actor, and there will be an assessor sitting there marking you, and you will get feedback written and verbally by the end of the case. If you purchase the course before classes start, what do? There will be a study guide given to you, so you can access the study guide. It tells you step by step what you should start working on, which books you should start reading right away. You will also get a mid-session feedback. This will pretty much be how well you are doing. So this is to answer the question on the chat. The mid-course feedback will be to tell you how well you are doing throughout the course in the eyes of the instructor. What are some things that we think you need to improve on? For example, if you're still struggling with over-the-counter cases, we will reach out to you at the midpoint and say, hey, you need to focus more on these so-and-so topics. These are some of our suggestions that we hope you can follow. This is just so you understand that we are tracking your performance throughout the course. So at midpoint, we will give you feedback if needed. Any other questions?
Well, somebody said that you have a really nice team. You will see the real face in the class. Like, you have a very strict assessors, but of course that's for your benefit, because nobody pays money to be told good job all the time, but your instructors will tell you the truth and how to work on your weakness and how to improve. So yeah, good luck.
All right. If there are no more questions, we will wrap up the session for the night. I do want to thank everyone for taking the time out and attending tonight's session. As promised, we will be sending out the recordings within 24 hours. If you have any questions, I've posted Vipul's number on the chat, so you can always reach out, and we will be prompt in answering any questions you may have. And we hope to see everyone very soon within the course and soon as practicing pharmacists.
If you don't get a number, it is on a website also. WhatsApp, you say hi, and I'll be able to answer you soon. Those who texted now, you may get an answer tomorrow morning, but I will make sure that it will be answered very quickly.
All right. Thank you, everyone, and I hope everyone has a wonderful night and a wonderful weekend.
Thank you, guys. Thank you for joining.